do the old recording thing. Hi, I'm Steve Musgrave, President of the Wellness Council, and I welcome you to this Zoom meeting, which we're recording so that you'll probably see it at a later date. But it's in April 22nd, and today we're talking about learning well, teaching workplace health promotion. But when Dave and I talked about this, we're talking about what many smaller companies really need to do. And that's getting a handle on what this big thing of workplace wellness is all about. What is risk? There's many components. It's not just Tai Chi. And we often get the Tai Chi instructor being the wellness provider to smaller companies. And it's not bad. They do the health fair and they can handle it. But the rest of the programming doesn't go because they don't know how to sell it. They don't know the great things that worksite wellness can do. So with programming of the worksite wellness, the Wellness Council has another meeting, May 24th. You're all welcome to attend. Bring your project idea, and we're going to share. Each person's going to get to share their project, what's going on at the workplace, whatever. And we'll try to build a little community here, and we'll meet as a group. Last time we had breakout rooms, so everybody could have that little get together with somebody they didn't know to meet them. Now you're going to do it all as a group. So with that, I'm going to send it over to Dave because he has a lot to talk about his program at Cleveland State University after being at Cleveland State, where we all know him for like 13 years. And now since he's an academic, he can give you a little more about his background.
Yeah, thanks, Steve. Yeah, I still don't think I'm an academic. My title is instructor. I'm not a professor. The students call me Mr. Pauer, not Dr. Pauer. And my whole approach is I'm a practitioner, right? And that's really why the department wanted me to teach here from a practitioner standpoint, not theory and things like that. We still talk about theories, good theories, but I can tell them here's exactly what's happened in my experience and why, and build it into the curriculum. And when you're talking about the small organizations, in fact, that I just had the class right before this presentation, and today's theme was incorporating workplace health promotion programs in a smaller organization. And talking about some of it's same ball game, smaller stadium. Some things have to be, there's strategies to try and get programs put into place, for example, with health insurance, doing group purchasing. But then there's advantages too, because communication is much easier, and doing surveys can be much easier. Sometimes you have all of the employees in one room, right? So things like that. So I'm gonna talk. Steve and I had talked about this. It'd be a good idea just to talk about the class in general. Just like when I'm teaching my class in person, please ask questions at any time, because I'll just go with the flow and we can answer things as I go. Whoops. Here. So the title of the class is, well, it's Health Education 360. So out of the College of Health Sciences. So it's a 300 level class. Again, the students are mostly juniors, so they're about 20 years old. A lot of exercise science majors. It's recommended that they take this class, but then also some general health science majors. Health science is kind of a general degree. The students from that can apply to medical school or physical therapy school or things like that. And then, I've got a couple of business majors and, history major and things like that. But this is the course overview. I know we included this in some of the communications, but just to highlight, talking about how to properly design from the very beginning these programs, implement them, of course, then evaluate them. And then what are the benefits to the company? So all the different benefits. You're going to have healthier employees. You're going to have lower healthcare costs. You're going to have higher productive employees, right? They've less absenteeism, things like that. And then there's different tools you can use, health risk appraisals, the theories, behavior change theories. I'll talk briefly about those. You guys, this audience is going to know a lot about those. And then barriers and incentives. So what are some of the things to overcome to implement these programs? And then how can you build in incentives for participation? So, and the textbook, just in case anybody's wondering, it's actually kind of old now. It's 7 years old, by Furtman, Workplace Health Promotion Programs, Planning, Implementation, and Evaluation. And very good content overall. Just that some of the stuff is kind of dated, like they're talking about apps as something that's like this new innovation, you know, and putting on your phone and things like that. Whereas now there's, you know, of course, there's you know, thousands of these that are available. But good textbook, and we kind of follow the text as far as the themes. I've just built in my own curriculum into those textbook themes to be able to teach the students, you know, from a practical standpoint. Like here's the experience of these different topics. And so the learning objectives, of course, this is something you have in any class. Basically, you know, after taking this class or after doing this session, here's what you'll be able to do. So you'll be able to describe how lifestyle behaviors affect health problems, identifying the benefits to employers for workplace health promotion programs, looking at corporate culture and how does that affect these programs. And to me, like, culture is everything, and it encapsulates everything. I've got, you know, one of the models that we use talks about that. So we're always bringing in, okay, here's the implementation of the practical aspects, but then how's the culture going to affect this? Is it going to be successful or not? I mentioned about the health belief, the different theories. So health belief model and stages of change. Talk briefly about those. Again, this audience probably knows health belief, and then stages of change is, you know, Prochaska, pre-contemplative, contemplative, etc. Terms and concepts, and I'll talk about that briefly as well, just so this is the one thing I start from the very beginning of the class. Let's define what we're talking about with these different terms, and we'll consistently talk about them in the same way, even though in the media or in other aspects, people may be referring to those terms in a different way. The components of the program, of course, and then this is key. I talk a lot about this because you look at strategies used to market the programs, and usually when people are talking about marketing, they're just talking about promoting. So they're talking about, like, let's get, you know, emails sent out or posters in the break room and things. And those different strategies are very important. Promotion is key, but I look at all 4 P's of marketing. So for initially, what's your program? Is it what the employees want and need, right? Are they going to want this program? Because you could have a great program, it's what they need. If they don't want it, they're not going to do it. And then looking at price and not just money, because you might be providing it at no cost, but time. Is it going to take a lot of time for them to participate? And then place can be key. Is it convenient for them to participate, or do they have to travel a distance or, you know, go somewhere? So when we're talking about marketing, I'm always talking about all 4 P's: product, place, promotion, and price. And then the policies overall. And are policies helping or hurting, right? Policies can help programs, and they can really hurt programs. Like the one nurse I had telling me at the hospital when we were first, you know, announcing the Healthy Choice program at Cleveland Clinic, she said, it's like you're stepping on the gas and the brake at the same time, because you're telling me all these great programs, but then I just left a 12-hour shift where I couldn't even go to the bathroom, right? So how are the different policies affecting the program overall? Incentives, of course, you know, building in incentives. They don't have to be huge to get people to jump. And data, and this is big. And I know John Doldner was on, Dr. Doldner. I don't know if you had a leave, but data is key. You want data in the beginning. You want to get all the data that is appropriate for the program to find out what's going on now, then figuring out what do we want to have happen and what are the data sets to make sure that that happens or not. And then how will we know if we were successful or not? So again, having those data sets to begin with before you're evaluating for the appropriate data. So, and then the curriculum overall. So this is kind of the flow of the curriculum in case anybody's wondering. So we start out in the beginning, the first classes we're talking about, for one, definitions, history, what's the history of these programs? And it's actually interesting. I've got a few examples here today. Legislation, that could be federal or state legislation, citywide legislation, and then the different theories on the program. So you're kind of setting the ground for studying the specifics, and then getting into the roles of leadership. And for me, this is a key component is your leadership, and not just from, you know, setting a good example and participating in the workplace health promotion program themselves, but leaders can be the best or the worst aspect of employee health and well-being. Great leaders create really healthy employees, and bad leaders create really unhealthy employees. So talking about that as a key design and component. And of course, human resources, where this is the department that is most involved with workplace health promotion programs, but many times is understanding the programs overall in pieces, parts, and components. And then benefit design, which can be key. You want a good, well-designed benefit program, and not just the health insurance, but of course, you know, dental and vision and things like that, but your compensation, your retirement plans, your engagement strategies, those types of benefits that create that feeling of well-being for the employee, volunteer opportunities and things like that. And then, of course, looking at planning, assessment, implementation, evaluation. And I always follow the model of when I studied at Case Western Reserve University. David Cooperrider had created appreciative inquiry, where you're looking at, you know, discover basically what's going on now, and then dream what could possibly happen, what's, you know, without limits of constraints of cost or anything. Then design it, and then deliver, and then goes back to discover how did that delivery work with that program, and you kind of just keep cycling with those appreciative inquiry concepts of discover, dream, design, and deliver. Best practices. So of course, you know, champions and advocates, and we talk about those separately. Champions are your folks on the committee. They're, you know, donating really about 2 hours a week on average. Maybe 1 hour is from work, 1 hour is from home, family time. The advocates are the people who really aren't directly involved, but they will always talk positive about your program. They'll run it up the ladder to leadership. They'll encourage others to participate, et cetera. And then partnerships and collaborations you can have, and that could be within the organization, in the community, with other businesses, et cetera. Data, as I talked about, of course, e-health, which is, you know, using the phone, using the computer. Population health, and I'll talk briefly about that. Again, that's one of those things you want to define, because everyone has a different definition of that depending on where you're coming from. Screenings and claims data, those are primary sources for these programs. You don't want them to be your only program. You also want someone who's really able to assess what's going on from those claims. It's not just, here's what happened and we don't know why. And of course, topics. And of course, people in this group, they're going to know all these topics. One of the prerequisites for this class is to take, it's actually my other class that I teach called Healthy Living. It's a 200 level class. You have to take that class before you take the workplace class, so you know, here's the general topics around this. But my thing is, I stress sleep. In fact, when people ask me what's the most important thing anybody can do for their health, I'd say sleep. It's the top 3 of 10 things you can do. And then when they ask what's the most important thing an employer can do, I tell them get good bosses and managers. Same thing, so it's the priority. But then of course, nutrition, physical activity, stress management. Mental health and safety, and one of the newer topics we're really talking a lot about is psychological safety, where people feel safe at work to be able to give their opinion, or they don't feel like they're bullied or things like that. It's becoming, it's always been an important topic and becoming more important in today's workforce. And then special populations, that's where I'm finishing up the class right now. We're talking about smaller organizations, hospitals specifically, which really are leading the way with workplace health promotion, nonprofits, governments, universities, schools, etc. But first, some definitions. So this is one of my favorite movies, Princess Bride. And I don't know if any of you have seen it, but you've got the one character, Inigo Montoya, who's supposed to be a Spaniard from Spain. And actually I have family from Spain. And I had a family member who thought he was actually Spanish. His accent was so good in that movie. But the one character is always saying inconceivable. And he at one point, and all these things keep happening that he didn't think were conceivable, but were. And he's like, you know, you keep using that word. I do not think it means what you think it means. And we do the same thing with workplace health promotion, right? So for one, what's a workplace, right? Defining that. So we define that right up front with this class. Of course, now it's work from home. It's really your community. It's of course a work site where you would work from, but centered around the organization as a whole. Wellness, and that means all kinds of different things to different people. Of course, it's got negative connotations for some people and positive ones for others. And it's, you know, celebrities selling weird products, you know, on the internet. So I define that for this class as the good evidence-based programs to build into your workplace health promotion program. So of course, nutrition and physical activity, stress management, but focused on the program. Well-being, looking at physical and emotional and even social health of the employee. So that kind of our overall encompassing aspect. Population health, and really focusing that more on coming from healthcare. And that's really who's kind of leading the way with population health, because they have all the levers. But employers can plug into that with their populations, with their workplace populations. And I'll talk briefly about that as well. And then, of course, what's workplace health promotion? And we're defining the workplace. Again, it's the organization is the workplace. It's not a site. It's many different sites, and it's wherever the people are. It's focused on the people. We use the socio-ecological model of health, where you can see the individuals at the core, and then interpersonal, the people around them. So that could be workers, their co-workers or family or whatever. And then going out from that, the community overall, their own organization. So the organization that they work for. And then the policies that are part of that organization, that community, right? So that could be legislation on the federal or state level, could be specific workplace policies, and then culture, right? Encapsulates everything, and it will always be the heaviest influence. And we see this kind of today with the policies on the things involved with the coronavirus, vaccines or masks, that the individual and then the people around them are heavily influencing them, their own work site and, you know, their own workplace and their community. Policies, of course, are in place, but culture just can wipe it all out. And we unfortunately have, you know, kind of a negative culture with that right now. And then these are the three, to me, this is the triple aim with these programs you're always talking about. You want to improve health of your employees and their family members, but you also want to increase their productivity and control costs. So it's kind of like the triple aim for healthcare, where you're trying to get people healthier, give higher quality care, and control the cost, and looking at that from a workplace health promotion standpoint. So a little bit about the history of these programs. So these go way back 100 years ago, mostly with safety. And you had things like railroads, which are very dangerous to work for, and building canals were one of the most dangerous things. In fact, as you can see here, the difference between, I don't know, 80 years ago and more recently, you've got all the OSHA standards in place. But when you look at one of the most dangerous places to work, the Panama Canal is ahead by far. 408 workers were killed for every 1,000 workers they had. So it was like a 40% death rate from working on that. And you look at this pictures of the most dangerous workplace ever, where you could be bitten by poisonous snakes or spiders, you could get malaria, you could be crushed by boulders, you get hit by a train, all kinds of these problems. And the French started this, and then the US took it over. And one of the first things when the US took it over, they had a physician who was looking at just the malaria cases. And he's like, all we need to do is put screens on the houses where people live. And we need to get rid of the standing water so you don't have all the mosquitoes. But before that, malaria, literally means in Italian or Spanish, bad air, malaria. They thought it just was kind of floating around. It's like, no, it's from mosquito bites. So get rid of the mosquitoes, malaria goes away. And they looked at some other things that they could improve the safety. But actually one of the best improving in safety was the Golden Gate Bridge in San Francisco. Super dangerous, right? They're up really high. And the chief engineer installed safety nets because that's how workers were being killed. They were falling. And they only had 10 deaths on this whole project. And it was only because there were 10 workers who were on scaffolding. The scaffolding gave way. It actually cut the net and they fell. But they would have had a 0 death rate from just all these guys falling in the nets. And they called these guys who fell into the net the halfway to hell group. They actually got a certificate and everything like that. But it showed you can improve the health and well-being of your employees. Then here's where we're at with the workplace history right now, more focused on determinants of health, built environment, policies and procedures, and then partnering. I talk a lot about social determinants of health and organizations that are doing a great job with this, but looking at things like education level, access to healthcare, of course, social relationships, the economic, pay, the neighborhoods that people live in. Those things all together influence health overall, much more than just healthcare overall, or just physical activity or things like that. We go through legislation, of course, some Occupational Safety and Health Act from 70s, all the way to things like of course we talk about about HIPAA, talk about the Affordable Care Act, all these different things, and spend a lot of time going through so they understand why this legislation was created and the effect it still has today. And we go through controversies. I'm sure a lot of folks in the group have heard about the things from Penn State and the latest stuff with Yale University, where frankly, they just had poorly designed programs that then the employees not only did not want to participate in, they strongly disliked, and then were able to get lawsuits filed and didn't necessarily win. I guess they got settlements out of it, but you have a precedent set with that. But the key thing is making sure that these programs are designed well, because when programs are designed well and implemented well, they work. It's when they're poorly designed and everybody just lumps in all the programs in one bucket. Theories. So just briefly on the different theories, we talk about health belief model, and I discussed this in relation with, now with vaccine hesitancy, right? Do people perceive the problem to be serious? Some people are calling coronavirus the flu. It's not. It's much, much worse. The individual perceives the problem as a threat to them, and they might say, oh no, I'm healthy, no problems. Well, yes, in general, unhealthy people can be more sick from this virus, but it doesn't mean you're not going to get it. Benefits of the action perceived, and this can be all over the board. Barriers to getting the planned benefits. So where do I go to get the vaccine, or is it available? And then are there encouragement to take action? And many times we see that there's discouragement. The cues are to discourage people from participating. And then probably the one I use the most, I use this at Cleveland Clinic. We use this at Cleveland Clinic was Prochaska, right? So the stages of change, readiness for behavior, pre-contemplation, contemplation, people preparing to take action, actually acting, and then trying to maintain them. And I talked about this in relation to all the topics. And in fact, now I have the students kind of identifying like, oh, they're probably in pre-contemplation. They're just not thinking about it at all, or they've taken action. And that's really what I want them to learn about those stages. Talk about stuff with the CDC. I know Steve can get these slides out to you so you can look at it. The total health management program, where this is everything that should be incorporated in a great workplace health promotion program, from your health plan design, good disease and case management, of course, things like your fitness center, primary care, which is critical, I think. It should be the center for all the medical side of things. And then your assessments, your claims data, having a portal for people to be able to participate in. I'm just going to skip through. We talked about the assessment, planning, implement, evaluating. Is again the same steps that I use in that process overall with design. The data sets you can get for these programs. So of course, demographic information about your employees, claims data, and the especially pharmacy. Pharmacy, you might get something that's not showing up in a medical claim. Absence management. Who's sick from work, who've gone on short-term disability, long-term disability, satisfaction scores, engagement types of things, and then employee assistance program for folks, getting counseling. What are they counseling for? I talked to them about algorithms, and this is a simple way to demonstrate what an algorithm is to try and figure things out. Do you have the flu? Yes or no? And try and help them figure it out when you're talking about huge data sets, at least having a simple concept for it. Population health, I talked quite a bit about Intermountain Healthcare out in Utah, and actually ProMedica right here in Ohio, which are doing great things with having housing close by for their patients in the community, improving schools, access to food. ProMedica has built a grocery store right in the middle of their lobby in the hospital. So incorporating social determinants of health into their population health strategies. And then talking about the overall strategy with population health management, from the medical side of things and all the data that can flow in, the devices that people use, the community resources that they have, and making sense of all that, having normalized data so people can be looking at the population overall. I talk about Dr. Duldner's, Connect and Care group, and about how his platform can actually pull in all that disparate data, and it's for the patient and their family to use and look at. Employers can incorporate that. The accountability for these programs. You want to prevent the conditions from ever happening to begin with. If not, detect it early, get stage 1 cancer, not stage 4. Reduce unnecessary testing, referrals, treatment, emergency department visits. You definitely don't want to go to a hospital where there's a lot of adverse events, infections, and wrong side surgeries and things like that. And then getting a lower cost at a high quality. And a lot of times people equate cost with quality, and it's unfortunately just not the case. This is actually from Robert Wood Johnson Foundation. I'll have you guys, you can look at it in the slides after, but talking about population health management, all the aspects of it, the social determinants, of course, medical care is a part of that. It's actually 20%. Most people think it's going to be most of it, and it's not. And then kind of like the planning process and all the different things that are part of this. from your champions and your advocates. We talk about both of them, to data sets, policies, culture, of course. And that's all I've got.
Well, that's great. You know, it's a very large subject. And you were
Yeah.
talking about not only what the wellness person has to know, but you were talking about benefits and the policies of the employer, making it an even greater job
Yeah.
for the individual to take on.
Well, and that's what I get asked by students a lot, like, how do you know all this stuff? I was really fortunate to be at the employee health plan at Cleveland Clinic. So you definitely know the insurance side of things and the benefit side of things. It's part of HR. But then you know the provider side because you're paying for everything. You're paying for all the medical care, pharmacy, the prevention programs, the wellness programs, and you're evaluating those all the time. And at the same time, you're talking with the employees about how do they like the program and, you know, communicating with them. So I'm just very fortunate to have that position as director for wellness with the health plan, where you're kind of at the center of all of these different moving parts of a good workplace health promotion program.
Well, you need all those parts because after all, the communication of wellness isn't done in a vacuum. And the workplace policies, as you know, you go into some employers and wellness doesn't work because they just had a layoff. The policies of the employer make a big difference in terms of uptake on terms of worksite wellness and the program's acceptance. It doesn't happen in a vacuum. Well, we got 2 minutes left before we're thrown off this platform. Any questions?
Any questions? Megan, Dr. Doldner, come on.
No, good stuff, Dave. I mean, and really for us, you know, we are a data place, but without the data, you don't know how to make decisions. And so I think that is the critical element. But it also sounds like, you know, in these settings, the uptake is broad, right? The penetration rate is broad. You know, if you had to graph this out on a, you know, a Gaussian curve, it would be, you know, wouldn't have a high peak, but you'd have wide tails. So, but I think in this case, yeah, having all that information and, you know, it's very circular, right? So it's got to keep going, and not everyone's going to get in there at the right time. You just got to make sure to try to, you know, leaving the door open, I think, is probably the best part about it. But you have to have the structure underneath, because if you don't have the structure underneath, then they can't do anything above and beyond. So.
Well, and that's why right now we're not doing guest lectures, you know, with trying to keep control in the class. In fact, I'm lecturing in a mask. Everybody's masked still in the classrooms and labs. But I want to have you come in and guest lecture for the big data lecture when we can have guest lecturers back in the classroom.
That'd be great. Yeah, I'm actually tested positive for 4 times for COVID last week. So
wow, you're my first 4-timer.
Yeah.
That's impressive.
I don't know if that's an impressive thing. So.
See, well, you're exposed a lot, right?
Yeah, I mean, still working in the hospital. Yeah, but yeah, it's crazy. So it's still around.
Yeah.